let's get started. Call this special meeting, or should I say emergency meeting of the City Commission of Rio Grande City. It is Tuesday, March the 24th, approximately 8:22 p.m. It is here in Commission Chambers, City Hall, 5332 East, U.S. Highway 83, Suite A, Rio Grande City, Texas. At this time, we'll have the invocation by Commissioner Garza, followed by the Pledge of Allegiance by Commissioner Jones.
Go ahead. Dear Lord, thank you again for allowing us to conduct city business. Today, we're here to take care of the issue with the COVID-19 coronavirus. And we ask you, Lord, that you help us to make the right decisions, not only for ourselves, but for our families and our residents of Rio Grande. We ask you, Lord, that you bless our county and state and federal officials to also make the right decisions in fighting this terrible epidemic. We ask you, Lord, that you continue blessing us and taking care of us, that you guard us from harm. In Jesus' name I pray, amen.
Yeah.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag and pledge allegiance to thee, Texas, one state under God, one and indivisible.
Next business and order is item 1B, roll call and finding of quorum.
Mayor Villarreal,
Here.
Mayor Pro Tem Garza,
Here.
Commissioner Flores,
Here.
Commissioner Ramirez, absent, Commissioner Jones.
Here.
We have a quorum.
This time, do we have anyone signed up for public forum?
No, sir, not
No.
at this time.
Moving on to item 2, City Manager's Report, letter A.
Hello?
Just discussion and possible action related to the City of Rio Grande City's response to the COVID-19 epidemic, including but not limited to extending the city's disaster declaration and amending the city's disaster declaration plan, Texas Government Code 551.071. This time I'll be calling Dr. Vasquez. And for the record, we have our city attorney on the phone.
Put them over here with me.
Your call cannot be completed.
Is this Victor over here? Yeah. Can you hear us, Cal?
Yes, I'm here. Mr. Flores, we're here.
Oh.
Okay.
Hello?
Hello, Dr. Vasquez.
Mayor?
Hi, I have you here on speakerphone. Here we have in Commission Chambers. We have Commissioner Flores, Commissioner Jones, and Commissioner Garza here in Commission Chambers. Good evening.
Commissioners, it's a pleasure to visit with you all.
Thank you for making yourself available. And of course, what we're working on right now is, of course, our continued plan for addressing COVID-19 and the issues, of course, and ramifications that come with it. So at this point, of course, continuing with the declaration and moving on to the first order and then the amended order in concert with what the county has passed as well in other municipalities here in Stark County. So just if you could tell us a little bit about where we're at with all this, please, Doctor.
Okay. It's an honor to be with you all there. The situation that we have right now is still no reported case positive for coronavirus infection in our county. We have started testing on a wide spectrum of individuals since the last Sunday. We have put together a joint initiative between Stark County authorities, hospital district, as well as the private industry, and some concerned citizens that have given up their voluntary efforts and have contributed to put all of these things together. We started testing on Sunday. We have had about 30 patients tested Sunday, 30 Monday, and 25 today, for a total of 85. With that, we have tested not just people in Starr County, but we have done as far as Harris County as well. We are testing regardless the ability to pay. We are asking the people who had insurance to bring proof of insurance, but those that are uninsured, we are covering for their tests without refusing anybody for payment, discrimination, or anything like that. Results should be available for us from tomorrow to the day after. There is no being a delay. It's just a technical issue. FedEx is the company that is picking up the samples and delivering it in Houston. During the weekend, they do not work. So tests done on Sunday were not delivered in Houston until early on today. From that moment on, it takes about 24 to 48 hours to get results. We are expecting to have something between late tomorrow, early the day after. In the meantime, we continue all of our efforts. All the clinics are working in full capacity. We are screening patients, and in the cases necessary, we are writing prescription for further testing. Meantime, the two nursing home facilities that encompass about 160 different residents are going to be tested for COVID-19 tomorrow. This is just a precautionary measure. I believe that since we do have a fairly good amount of test kits available, we have to be targeting the most at-risk population, which is our elderly, especially those in nursing home facilities. So starting from tomorrow, we are going to be testing on all of the residents of the two nursing home facilities that work within the county limits, and we will probably test the employees as well, and that will depend on their insurance carriers. Other than that, hospital is being in the process of acquiring hydrochloroquine, which a lot of people had a lot of hopes as a potential treatment to mitigate the symptoms and shorten the course of this disease. We are also in the process of getting 5,000 N95 masks, as well as we have requested 500 PPE sets to be delivered for the county. So altogether, I think that we are way ahead of the curve. We are expecting to be getting positive cases sometime within this week. I don't think that there is a way to avoid that. But farther from being a cause of concern, I think that this should be a way to let the people know that we are being very proactive. We are testing a lot, and we are going to get, as consequence, significant number of cases positive in our community. That will help us to identify the most at risk. We will enforce quarantine to that population, and we will conduct epidemiological studies in the close contact so we can further isolate and prevent spreading further of this disease.
So you're at this point, looking at the numbers, you are anticipating positive results within the next few days. Is really what?
Certainly, yes. And Major, if I was to follow national guidelines or national statistics, about 10% of all the samples that are being tested in this country are coming back positive. There are some clear exceptions, including New York, where there are about 35% of the cases positive. Nationwide, the average is about 1 in 10. So if we were to follow the same guidelines or the same projections, we have tested 85 people, so we will be getting somewhere between 8 to 9 cases. I am not sure that's going to be the case. I think that we have been somehow liberal at the time of testing. Since we have plenty of testing material, we have been generous at the time of following guidelines. So probably we will not have 8 cases, but perhaps 3 or 4. That will put us a number similar to what McAllen is today or Hidalgo County. So that will be a reason why citizens in Starr County are going to show concern, and perhaps they will go into panic. I've been constantly in the radio and in social media informing them that this is something that is going to come, that we should be expecting those results and this is not a reason to panic. Furthermore, this is a reason to be reassured that we are doing the correct measures to try to prevent further spread on this problem.
In other words, we are expecting this. It's something that we've been preparing for, and at this point, that's why we're here today as well. Of course, we're looking at extending our declaration as well as the first order along with the amendment. And just to be clear on that, Dr. Vasquez, on the amendment, we're looking at, of course, the curfew from 10 to 5, very similar to what the county is doing, as well as the shelter in place or the stay at home. And of course, focusing on the essential businesses. Obviously, if they're essential, people will continue to operate as long as it's related to essential needs. Now, there are some questions, for example, and I know you've mentioned this. At this point, is it your recommendation to close down the adult daycares or any type of daycare facility, as well as anything that's, whether it's nail salons or barber shops, that sort of thing?
Yes, it is my recommendation. Anything that involves physical contact, social closeness, we need to shut those business down. It is not in the best interest of the health for our community to keep those facilities open, because any possible avoidance on contact is a step forward in trying to mitigate the disease. So nail salons, barber shops, hair salons, adult daycare centers is all a situation where there is a potential risk of contamination, and that's not helping us at this point.
Okay. And you're looking for, what would be an advisable period of time to do this? I mean, what are we looking at? How much time would you recommend?
All the projections measured are now between 2 to 3 weeks as the time frame that we will need in order to reach to a peak and then to start plateauing and then going down. So I do not foresee that the situation is going to get any better, at least in 2 to 3 weeks. Perhaps it will get worse during the course of these 2 to 3 weeks. We will need to revise at that time if the conditions are those that could allow us to reverse somehow any of these decisions that we are making today, but I do not foresee it's going to be any time sooner than that.
No, one of the main concerns nationwide is, of course, the availability of ventilators. How is that here as far as ventilators, and how does that apply to us here?
In our hospital, we have 16 ventilators now. I pray that we do not need to use 15 ventilators, but if the situation was to arise, we are already making the necessary arrangements with our affiliated organization, Doctors Hospital of Renaissance, where they are going to help us with patients. They will accept our transfers, and if necessary, they will support us with pulmonologists and intensive care physicians to help us managing those patients here. However, after the 15 ventilators were to be used, if the situation was to be that, there are in the national stockpile, there are ventilators available. However, every other county or every other health authority are going to be fighting to get those. So I don't think that we can count on much of help from the stockpile. We will have to deal with whatever we have right now, which is 15 ventilators.
Which goes back to us making sure that we limit the amount of positive cases as much as possible by continuing to take all these measures that we are taking. Because at the end, that's what it comes down to, minimizing that how many people are infected or sick at the same time, which goes back to...
And certainly, Major, to explain you a little bit, and I know that you are all very educated people and you will understand this, but just to give you a little bit more of clarity, when people talk about flattening the curve, we hear about the experts all saying about flattening the curve. What it means, it doesn't mean necessarily that we are going to have less number of patients. it means that we need to spread them more in time. So meaning, if a population was to have 1,000 cases of COVID-19, it will make a tremendous difference if those 1,000 cases were to come within a week versus if we were to deal with them in a 3-month span. Because in 3-month period, the healthcare system of the community will not be overwhelmed. We will be able to manage with those 10, 15 ventilators. We will manage with the manpower that we have, and the system will not be overcome. However, if those 1,000 patients were to present all together in a week span, for sure we won't be able to manage that volume. That is where patients will be dying. That's what has happened in countries like Italy and Spain, where there is a very significant rate of mortality, and not just related with the severity of the symptoms, but basically because the system has been overwhelmed and they are working way more than capacity, and they cannot take care of everybody that they should be taking care. So the situation, if we were to be talking about an individual case, it could have been managed. However, when you have to make decisions about who lives and who dies, that is where you see those mortality rates going up.
So really is to, bottom line is for people not to get sick at the same time.
Exactly. And the only way to achieve that measure is taking measures, like the one that you are just about to make now. I mean, asking people to stay home, mandating people to stay home and to prevent all unnecessary travel outside their house. I mean, social isolation is the key word in all of this.
Commissioners, any questions, anything else, Doctor, before we close the call here?
Just to praise all what you all are doing, Commissioners. Thank you very much for your big efforts, and we are fully behind you all in this. We need to be all together in the decision that we make, and we need to make people understand that these are hard decisions to make. However, the option of not doing it is not an option. We have just a short, brief period of time. It's the next 2 weeks to make it or break it. So it's in our hands to make it. Thank you very much for allowing me to have a voice in your city council meeting.
Thank you, Doctor. Appreciate it.
I appreciate it. Have a good night.
Likewise.
Thanks.
Okay, so at this time,
How many ventilators did he say that we have at the hospital?
15.
15?
So the whole point of this is, of course, minimizing how many people. We don't want for everyone to get sick at the same time. So of course, the whole idea is to spread it out as much as possible because of especially going back to us.
It's probably the phone.
It's the.
It's because, no, Cal is on the cell phone, remember?
Oh, okay. Are you still there, Mr. Ariel?
Yes, I'm here.
Okay, all right, thank you, sir. So again, it's minimizing how many people get sick at the same time, because the ideal is if some get sick, okay, they get better, next one, and then you just continue, right? And that's why this.
He talked about a treatment.
Well, those are the severe cases that do need ventilators. The majority, according to the little that I've come to understand based on the meetings that I've had with Dr. Vasquez, right, is that the majority are not going to need any medical assistance, but a good percentage will. You know, that's that 15 or so percent, maybe less, right? Which would be the critical care. And that's the critical care. I mean, you don't want to have too many people needing those services, ICUs.
He did mention that all the patients at the nursing homes are going to be tested.
Yes. You mentioned we have, through this partnership, quite a bit of tests, and obviously now, how many people are being tested? It's close to 90 in 3 days.
Yeah.
And I'm really glad that they're addressing the adult daycares and daycares for children, because those are very two vulnerable, classes of people that are, that could be exposed. The one thing that I don't believe that I've heard anybody address is the issue with home health providers, because they do have a lot of contact with other people, and then they go to homes about these elderly people. How do we know that, how are we addressing that issue?
Well, as.
Well, then they have to continue providing the medical service.
Yeah. When it can, of course,
That's part of the doctor's orders for them to take care of these people at home.
yeah, and anything that's home related, then obviously that we're not gonna, I wouldn't wanna touch at all, anything that's home services, whether it's those type, obviously those type of services. It's more the congregation of people, and of course, you have the qualified staff, right, that are supposed to be taking all these measures. And if they're not taking those measures, then obviously we need to bring them up to their attention, which is what we're doing. For example, I know HEB has been very proactive on the measures that they're taking. And part of all this is, and this is what I have in mind with this, what we're trying to do here is educating the public, going back to the idea that it's education before citation, right? The whole idea is not to just go out and cite people, it's to educate them before we even mention anything regarding citations. I say education before citation. And I think the majority of people are willing to step up. They already have, we've asking so much from people, and by far the majority are complying, the majority are taking these measures. And of course now we're at as he mentioned, the next 2 weeks, the next 2 or 3 weeks is gonna be the main crux of this. What we do now is really gonna come down, are we able to make a dent
We're
in
at
this or
that
not?
critical point.
We're at that critical point, so, and as he's recommending, and I believe strongly that we should go with his recommendation about, again, shutting down the daycares. And again, these are daycares. Now, we're not talking about residential facilities, anything regarding home. These are daycare services. They can still do the home service if they need to go home and do those kinds of things. Of course, the daycares, the same thing with anything that's regarding for people close contact. Whether it's nail salons, again, you have the physical contact, you have the barber shops, where there's physical contact. And again, this is, of course, our health authority recommending this. And
Basically, the residents, are asking just a question, and basically with this emergency declaration, Mayor, we just want to make it clear to the residents that, if you don't have to leave your house, don't leave. That's basically what it is.
it's the essentials, going back, if you need, if something essential is essential, if you need food, if you need water, if you need gas, those kinds of things are not gonna be affected by that or work, things like that, hospitals, governments. All that is not going to be affected. It's the unnecessary, let's get out of the house to go cruise around, or let's go out of the house to do. No, the idea is to stay at home. And that old catchy phrase, stay home, stop the spread, save lives, which is the caption that's being promoted. And the thing is, things that are unnecessary. For example, I've been, for example, let's say, and I keep bringing up HEB or Walmart, right? But let's say those grocery stores. If there's a way that we can continue to educate the public that if designate somebody to do the shopping, there's no sense in sending 2 or 3, 4, 5 people to shop. Now, obviously, if you can't leave children at home, that's fine. But if there's a way that you can just assign one person to do the shopping as opposed to having 3, 4 people, 5 people from the same family, I would encourage just one person. Little things like that can make a difference in minimizing that spread, the spreading of this virus again, or the potential of it. And again, that's something that we need to educate the public and encourage people to do those kinds of things. If your children don't have to get out of the house, and again, being at home, why take the risk of taking them to HEB if you don't have to? Again, I understand some people are not going to be able to, but if you can, then just designate one person to go. Or other things like that. Other examples I'm sure exist. If you're going to go pick up an order, for example, why does everybody have to go? Just one person. Things like that.
How are we gonna put this information out, man? I know that, look, I found out today that social media, whatever we put on social media doesn't get to everybody. And we need to figure out a way either to use a newspaper or some other means to let these people know what is it that we're doing here at this meeting. Because I guarantee you, today I found out personally that people are not getting the message through social media. There's some, not a lot of people, but there is some people that are not getting that message.
Is that because they don't have social media or they just don't get it?
Well, I was embarrassed to ask, but
at some point, it's come up with a plan. For example, Ms. Custer, do you have anything to add to that?
I do. So we have it posted on our city website under residents. There's a tab, and if you scroll down, there's public safety. So right off the bat, we have our latest declaration that has been posted. We also have been reaching out to all local media, so they all have copies of each signed declaration in order. They also have all the messages and video that the mayor has been declaring with these orders. And we also post them up on social media, not only the verbiage, but also those videos. And currently we're live streaming, we have about 120 something people that are watching right now. So the number fluctuates between 115, we have quite a few people that are watching because they are concerned. And so they're looking to follow your lead. So people are listening, people do call in, but I think EDC is also working to make sure that the businesses that want to know how is this going to impact us, they're also reaching out to them because they have their numbers, their email, their contact information, and they're also sending them those documents. So that way they have another avenue to be able to have those resources available to them. So we're trying to find ways to reach out to them. It just seems that the most effective so far has been social media. As soon as something gets posted, whether it be from our own page or from a local news outlet, we get calls almost within minutes, if not seconds. I think Ms. Garza saw a little bit of that today. Our phones are ringing off the hook, so that has been by far our greatest reach, but we can always do better because there are people that do not have social media.
yeah,
So we are
and
doing our best.
I think that we need to try and
Well, it's coming
use
up with
other means.
Yeah, I mean, we can definitely put in the paper, that's fine. I know that we
The
can have,
monitor receives our notifications, the local, El Tejano, La Pistolera, Telemundo, Univision, Channel 4, Channel 23, Channel 5, they all receive these notices from us as soon as we post them online.
And you can also select your audience. You can select the target audience for each post, and that reaches a lot more people too. Because sometimes, and because I, when the city posts something, I don't immediately get it, and I don't always get every single post, but I see somebody else shared it. But if you do you target an audience, then people will see it.
we can include a paper, that's fine. I mean, a paper, newspaper, let's say newspapers. And at this time too is ask our city manager and all the code enforcement and personnel to educate the public, give these orders to the business owners, so that way, and we can start, because again, the idea of this is to educate people at first, a period of education here, without the citation, right, Chief? The whole point is not to, we're trying to help and ease the situation here, is not to create more. And the way to do it is educating the public, giving some time to adjust to this. And I think by and large, the majority of people are already expecting something like this. Why? Because it's been leading up. And if you've noticed, we've been taking incremental steps. We started off with a declaration, and then from there an order, and then we're working on an amended order. So it's been gradually incremental. So, but let's look at that plan, Ms. Custer, as far as our education of the public and businesses and everyone in general. And at this point, good point, you know, we need to make sure that everyone is familiar. And as Dr. Vasquez mentioned, is let's try to minimize that fear and the panic, because again, there is no need, and I'll say this again, even if we approve this order, there is no need to go panic buy again. There's none of that. At this point, this would be essential items. Groceries are considered essential, so there's not going to be any type of overlay there as far as not having those accessible. Work are essential items, governmental entities, hospitals, clinics, pharmacies, gasoline, all that are considered essential. So there's no need to feel that there's going to be a panic and now I have to rush to go get all these items. That's not going to change. All we're trying to do here is, again, as Dr. Vasquez mentioned, flatten that curve. We don't want everybody to get sick at the same time, which by us doing these measures, that will help in minimizing that risk or that probability.
Mayor, one of the things that we do need to clarify, but because I did hear Dr. Vasquez mention essential workers, and I know that I've gotten messages and calls regarding, you know, what is essential workers. I mean, at the national level, you know, it's a very specific group of workers, so we need to make sure that people know that it's not limited to that, whether it will be limited to that specific group of people, workers, or not.
Well, I mean, if you look at as we're reviewing, there's in fact, look at the order and the amendment and see if we want to add anything or change anything. And you're looking at 2021-A and go down to, we're looking at sections, start with section 6, minimum basic operations and what we're trying to do here. And going back to the main industries, so it's non-essential, you know, non-essential, which goes back to a need. And as Dr. Vasquez mentioned, adult daycares or barber shops and spas and those types of things, that's what we're, at this point, what he's recommending to close. And we are asking employers to consider, just like what we did here at City Hall, we're working on a skeleton crew. You know, we're taking those measures to minimize the exposure. So even us here, we're going into skeleton crews and minimizing spreading that out. So we are asking obviously employers to do that when it's possible, right? I mean, obviously in some cases, it's just not possible. But if you look at the amended order, it considers the non-essential versus essential. It covers essential travel. Obviously, if it's essential travel, then that's not going to be an issue there. And it gives you some of the definitions as well. What is considered essential personal activities. If you want, take a few minutes to look it over, and then that way we can, if we need to add anything else, then we should add it. And if you look at essential business also, it defines what essential business is, which is very, very similar. Keep in mind that this is very similar to also what the county is doing with some of it, right? Some of it pertains more to us. And it does have that 10 p.m., 10 to 5, in essence, of a curfew, where we shut down for the day. Now, again, for example, when it comes to HVAC, electricians, anything related to house that's not going to be touched, food, shelter, social, anything like that, of course, that's not, television, radio, any of that's not going to be, banks are not going to be affected. And of course, we do, going back to that recommendation, is to try to minimize the staff as much as possible. But with that in mind, that in some cases you can't, right? Of course, continuing with restaurants, they're gonna continue to operate, it's not gonna be, drive-through and all that continues to operate. The only difference is gonna be the 10 o'clock, that we're shutting down. So, and now really what we need to do is, one, we're looking at extending the declaration, if we so choose, one, and then two, continuing with the order and the amendment. Is that correct, Mr. Villarreal, on the, moving on?
That is correct.
So it's,
Correct.
the declaration, plus the order, the first order, along with the amended portion, which is added on here. And,
Correct. The first thing you need to do is obviously extend the declaration and then move into the second step, which is the order.
okay. So at this,
And we're gonna, do we need to mention in the motion, to when
The
we're
expiration
extending?
date.
the expiration date, yes, we need to include an
Correct.
expiration date. So what, now,
Whatever date you use, you can always come back and shorten it in the future.
Dr. Vasquez recommended 2 to 3 weeks.
The declaration states April 13th.
Yeah, which is about
I
2
think
weeks.
13 is good,
Yeah.
and we need to extend it, we can just come back and do it.
so. So, I mean, at this point, then, of course, we can always come back and continue an extension, so is everybody okay with, 2 weeks at this point, and then convene and then, yes?
I'm good with the 13, Mayor, and if we need to come back and if the doctor, is recommending for us to extend it, we can come back and extend it. How much time did he recommend, Mayor?
I'm in agreement as well, Mayor.
Okay, so the 13th. And like you said, at some point, if, for the grace of God, this was to end, we can always come back and terminate all this, right? And obviously, that's what everybody would be hoping for. But at any point in time, we can extend it or change it, modify it based on, remember this, that this is evolving on a daily basis. What we know today might change tomorrow. And we need to adapt with that. And obviously, the good thing with this commission is that we're able to adapt very quickly with any of that. So let's continue to adapt. And obviously, information keeps changing. And that's why people are so scared, is because of the uncertainty of this. You hear one thing today, tomorrow you might hear something else. And that's why sometimes, I understand why the fear. But
Just make it clear to the residents, Mayor, that if you need to stay home, stay at home. You don't need to get out of your house, don't leave the house. Just leave, you need to go buy the necessities to be able to live a life to life, Other than that, just, help out the system and let's get over this and stay at home. If we do that, this is gonna pass. But, we need to follow doctor's orders, and the residents need to play their role and stay at home. They need to stay at home, and if they need to go get groceries, try to limit the persons that are going out, to make it easier for everybody to be able to get their eggs, toilet paper, beans, rice, bread. Everybody goes out at the same time, it makes it hard for the grocery stores to, stay up with everything. So, just plain and simple to the residents of Rio Grande City, this order is just to try to make everybody just stay at home. If you don't need to get out of the house, don't get out, please.
okay, so then do we?
You need a motion,
The
ma'am?
motion, Mr. Villarreal, then would be one, a motion to extend the declaration, and then two, in the same motion to
Amend.
extend the amendment, or how does it, give me the exact,
Let's do the first, just the motion to extend the disaster declaration. And you're gonna give it an expiration date, I believe I heard April 13th, right?
Yes.
okay.
Is that the date I heard?
What's that?
April the
You
13th.
all said you agreed to extend it till April the 13th?
The 13th is, okay, so
Okay.
let's start with that, the
What-
declaration.
Correct, and just make the motion to extend the declaration and give it the expiration date of April the 13th.
Now, to be clear on the item, it says A and it has both of them combined. Can we just do both? Because it has letter A and it's combining both. One, the declaration, and then
Extending and
two,
amending.
to extending and amending the city's disaster.
Victor, should they do both of them at the same time, or just do
They should probably separate it, one motion for each.
Yeah,
Yeah,
One motion?
yeah, do,
One motion for each.
yeah, do.
One motion for each.
Okay, so then go ahead and do
Okay,
the.
okay, Mayor, then, I'll make the motion to extend, the city disaster declaration till April the 13th, and also amend the city disaster declaration plan.
Okay, so we have a motion, is that,
You want it
No,
separate.
no, one, so you gotta separate them.
You need to do one and then
Yeah, and then go back and do the other one.
Correct.
one at a time.
I'll second the motion.
Okay,
Extend it primero. and then-
all right, so let's do the one first.
okay.
Let's do the
Okay,
declaration.
Mayor, my motion is to extend the city's disaster declaration till April the 13th.
I second that, Mayor.
Okay, we have a motion to approve extension through the 13th by Commissioner Garza, second by Commissioner Jones. All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries.
Mayor, and I also make the motion to amend the city's disaster declaration plan.
And I second.
Okay, and we have
Declaration order.
the declaration orders?
Yeah.
Yes.
The
Okay.
Declaration order.
Correct.
Declaration
This is the
order.
second motion. Correct.
And to also extend that order until the April 13th.
Extended also till April 13th?
Yes.
Okay, so you make a motion?
I second. Are you
All
gonna
right,
do it
so
again?
say it again. All right, so Commissioner Garza made the motion to extend the order,
To amend.
to amend and extend the order to the 13th. Is that
Correct.
correct? All right, and we have a
That's
second?
correct.
Second.
Second by Commissioner Flores. Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Anything else to be clear on this, Mr. Villarreal?
No, sir, it's, we send the declaration, the order, Melissa should have it ready for signature.
Okay, perfect.
Yeah,
All right.
we'll get that.
This time, do we have a motion to adjourn?
So moved.
All right, we have a motion to adjourn by Commissioner Garza, second by Commissioner Jones. All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Meeting adjourned.
9:05?
Praise the Lord.
It is 9:05.